Depression: the best treatment options. Most mental health experts agree that the best natural treatment for depression is talking. Types of talk therapy include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. As a group, these forms of therapy for depression are called psychotherapy. Other types of natural treatments for depression that are frequently used include dietary supplements, exercise, meditation, and acupuncture. Psychotherapy, with or without medication, is the best way to treat depression, advises Richard Shaddock, Ph.D., Director of the Counseling Center and Adjunct Professor of Psychology at Pace University in New York City. However, he adds, there are some alternative treatments that can help mild to moderate depression. Natural treatments for depression: exercise. Exercise, if done correctly, is one of the most promising natural treatments for depression. It elevates mood quickly and reliably. A recent review of all the available controlled trials that compared exercise with either no treatment or another type of established treatment in people diagnosed with depression concluded that exercise does relieve symptoms of depression. But how effective and which type of exercise is best remain to be seen. Many studies, going back to 1981, support the use of exercise as part of a treatment plan for mild to moderate depression. Most experts suggest about 30 to 60 minutes a day of moderate exercise to lift your mood. Natural treatments for depression: meditation and yoga. Relaxation techniques such as yoga, deep breathing, progressive muscle relaxation, and meditation have all been used to relieve symptoms of depression and reduce stress. These mind-body techniques can promote feelings of joy and well-being. Using these same meditation practices, called mindfulness-based cognitive therapy, several studies have found that meditation can reduce the risk for a recurrence of major depression. Natural treatments for depression: dietary supplements. Many people use herbs or dietary supplements as natural treatments for depression. It is important to remember that some of these supplements can have side effects or can interfere with other medications. Same, S-adenosyl L-methionine, is a synthetic supplement that is made from naturally occurring proteins in the body. It has been used to treat depression as well as osteoarthritis and liver disease. A review by the Agency for Healthcare Research and Quality found 47 studies in which SAME was used for depression and concluded that SAME worked better than a placebo. Natural treatments for depression: acupuncture. Acupuncture is increasingly being used as a natural treatment for depression. One area where acupuncture has been studied for depression is in depression associated with pregnancy. Because of potential side effects of drug treatment in women who are pregnant, acupuncture would be a valuable alternative. In a study published in the Journal of Affective Disorders, 61 pregnant women with major depression were treated with acupuncture specifically tailored to treat depression, general acupuncture that didn't target depression, or with massage therapy. The women who were treated with acupuncture specifically targeting depression had a response rate of 69%. In comparison, the response rates were lower for those who received general acupuncture, 47%, or massage therapy, 32%. If you have depression, work with your doctor to find the best treatment. If you decide to try natural treatments for depression, let your doctor know. Remember, some of the most effective ways you can help your depression besides taking medication include eating well, getting enough sleep, avoiding stress, and having a good support system. Exercise. Regular exercise can be as effective at treating depression as medication. Not only does exercise boost serotonin, endorphins, and other feel-good brain chemicals, it triggers the growth of new brain cells and connections, just like antidepressants do. Best of all, you don't have to train for a marathon in order to reap the benefits. Even a half-hour daily walk can make a big difference. For maximum results, aim for 30 to 60 minutes of aerobic activity on most days. Nutrition. Eating well is important for both your physical and mental health. Eating small, well-balanced meals throughout the day will help you keep your energy up and minimize mood swings. While you may be drawn to sugary foods for the quick boost they provide, complex carbohydrates are a better choice. They'll get you going without the all-too-soon sugar crash. Sleep. Sleep has a strong effect on mood. When you don't get enough sleep, your depression symptoms will be worse. Sleep deprivation exacerbates irritability, moodiness, sadness, and fatigue. Make sure you're getting enough sleep each night. Very few people do well on less than 7 hours a night. Aim for somewhere between 7 to 9 hours each night. Social support. Strong social networks reduce isolation, a key risk factor for depression. Keep in regular contact with friends and family. Or consider joining a class or group. Volunteering is a wonderful way to get social support and help others while also helping yourself. Stress reduction. Make changes in your life to help manage and reduce stress. Too much stress exacerbates depression and puts you at risk for future depression. Take the aspects of your life that stress you out, such as work overload or unsupportive relationships, and find ways to minimize their impact. If you suspect that you may be depressed, and lifestyle changes haven't worked, make an appointment to see your primary care doctor for a thorough checkup. If your depression is the result of medical causes, therapy and antidepressants will do little to help. The depression won't lift until the underlying health problem is identified and treated. Your doctor will check for medical conditions that mimic depression, and also make sure you are not taking medications that can cause depression as a side effect. Many medical conditions and medications can cause symptoms of depression, including sadness, fatigue, and the loss of pleasure. Hypothyroidism, or underactive thyroid, is a particularly common mood buster, especially in women, older adults, or anyone who takes many different medications each day, are at risk for drug interactions that cause symptoms of depression. The more medications you are taking, the greater the risk for drug interactions. Talk therapy is an extremely effective treatment for depression. What you learn in therapy gives you skills and insight to help prevent depression from coming back. There are many types of therapy available. 3 of the more common methods used in depression treatment include cognitive behavioral therapy, interpersonal therapy, and psychodynamic therapy. Often, a blended approach is used. Some types of therapy teach you practical techniques on how to reframe negative thinking and employ behavioral skills in combating depression. Therapy can also help you work through the root of your depression, helping you understand why you feel a certain way, what your triggers are for depression, and what you can do to stay healthy. When you hear the word therapy, you might automatically think of one-on-one sessions with a therapist. Both group and individual therapy sessions usually last about an hour. In individual therapy, you are building a strong relationship with one person, and may feel more comfortable sharing some sensitive information with one person than with a group. You also get individualized attention. Don't rule out group therapy, however. Listening to peers going through the same struggles can validate your experiences and help build self-esteem. Often group members are at different points in their depression, so you might get tips from both someone in the trenches and someone who has worked through a challenging problem. As well as offering inspiration and ideas, attending group therapy can also help increase your social activities and network.